I'm here with Dr. Marklambert, Gateshead's Director of Public Health. Mark, for the benefit of those in the room who don't know you perhaps, tell us a little bit about yourself and your responsibilities.
Sure. I qualified in medicine back in the 1980s in London. I then did quite a lot of hospital-based clinical work before coming into public health. I trained in public health in Yorkshire, and about 5 years or so ago I came up here to the northeast, and I've been Director of Public Health here now for a little over 3 years. You asked me as well about being a Director of Public Health. I guess I see those responsibilities as being threefold. Firstly, around promoting and improving the health of people in Gateshead, very important. I also have some responsibilities around protecting the health of local people, and by that I mean against potential threats to their health from the environment, and also from infectious and communicable diseases. The last of the three is around making sure that local people have access to the highest possible quality of healthcare, and in that I and my team support Gateshead PCT in commissioning services for local people.
This event is called Choosing Health, Tackling Health Inequalities. Choosing Health, first of all, what exactly is that?
Choosing Health is the title of a government white paper published at the end of 2004. And the title is quite helpful in that it describes really what's inside the tin, in that the white paper is about making healthy choices easy choices. And perhaps if I could just give an example of what that means. I think most of us, when we think about the food that we eat, the meals that we eat, probably we know that the easiest thing to eat, the easiest thing to get, is probably what we call fast food, which is high in sugars, high in fat, high in calories, much more than we really need. And the idea behind choosing health and making healthy choices easier is both to let people know what the healthier choices are and to make those easily available. So things that have better nutritional content, lower elements of saturated fat and refined sugars are readily available, cheap and accessible.
Thanks for bringing us up to speed on that. Now can you tell us what has the PCT so far done towards it?
The PCT has been working with all of the other agencies in Gateshead to think about how we plan for that. We've done quite a lot by way of events that help inform practitioners at the front line, and we've also tried to build our plans for thinking about all of the lifestyle factors that are mentioned in the Choosing Health document, the nutrition, overweight and obesity, around sexual health and around smoking. We've been bolstering our existing plans and looking to see what investments we can make for the coming years.
This particular event is about health inequalities. What do you mean by that, and why is it important that we look at this issue?
That's a good question. I think probably the easiest way of talking about inequalities and health inequalities is to talk about fairness, which I think is a concept that probably most people will more easily identify with. The way I tend to think about and describe health inequality is through an example that a GP from South Wales talked about and wrote about in the late 1970s. The man's name was Julian Tudor Hart, and as I say, practiced as a GP in the mining communities in South Wales. He was one of the first to describe about the access to healthcare of deprived populations who had poor health. What he did was he looked at the different levels of affluence, different levels of disease in populations and showed the relationship between those levels of affluence and disease and the relationship to the amount of healthcare that they had access to. And he told the story that probably most of us actually know really quite well now, which is those areas that are more affluent, that people tend to live longer. They're also the areas which tend to have more doctors, higher levels of referral to hospitals, and higher levels of prescribing. So generally what Tudor Hart was saying was, if you live in a poorer area, you tend to get fewer doctors and less access to healthcare, but you die earlier. And that clearly I think most people would recognise as being unfair and what we'd call inequality.
So are health inequalities a particular problem in Gateshead?
They certainly are, and unfortunately. The statistic that I started quoting when I became Director of Public Health a little over 3 years ago now was that if you live here in Gateshead, you die on average 2 years younger than in the rest of the country. And that's as true now as it was when I started being Director of Public Health. So I'd say, yes, health inequality is a really important issue for local people and should be a really important issue for local service providers.
Is this Choosing Health event in any way different to the previous ones the PCT's held?
I hope that at least two of the ways in which it's different are very obvious to people already. The first one is the way that people are seeing me now, in that rather than standing up in a room in front of you, I'm doing this initial part of the day by interview through the weblog, which CHI, the Centre for Enabling Health Improvement, run as a vehicle for communication about health improvement to a very wide to a very wide audience. Secondly, people will obviously recognise we're in a different sort of a venue today. The previous events of this type we've held in very different venues, like the Civic Centre, for example, and this is a very different choice to use a community-run venue in a different part of Gateshead. So I'm sure that's very obvious to people too. And lastly, it's different in terms of the people that have invited and are here today. The previous few events that we've had on health topics like sexual health, like smoking, and like physical activity, have been very much practitioner focused. But this event today is very much more focused towards policymakers and getting them to think about health inequality in its broader sense.
What are you hoping will come out of today?
I'm hoping that people will go away certainly understanding the issues about inequality better, and that they'll go away with sufficient enthusiasm and recognition of the significance of the issue for them, that they'll be wanting to make sure that they address inequality within their own group's work programmes.
How can everyone here today then get involved and contribute to this?
I suppose the first thing is to be open to the learning and probably to recognise that there are a lot of people in the room with a lot to contribute. So there's a lot to listen to from the people that are around the room, probably to contribute themselves in a reasonably open and non-technical sort of way. Don't assume that everybody knows what you're talking about, I think is an important thing too. And I suppose lastly to contribute that feeling of commitment that I was describing about earlier, I really do believe that tackling this agenda is important to everybody in this room and well beyond it, and we need that ongoing contribution to making sure that when people leave this event today, that they will take up the baton and make sure that in their work they do, as a very high priority, tackle health inequality and those that exist for local people.
Thanks for setting the scene, Mark. I suppose it's time now to get down to nitty-gritty.
Yes, thank you, Kay, and I hope that everybody today will find this a very interesting and stimulating morning.